Well, it's 2 o'clock actually, so we can get started. So welcome to the webinar today. My name's Lucy Caldwell. I'm the nurse at Carebean, so I'm a registered nurse. And I host these webinars every month, last Tuesday and last Thursday. So do feel free to join future ones. I think we've got mouth care next month. You can access the website to register for those. Anyone's welcome. We're sort of mainly concerned with care planning. So this is for customers and non-customers. We're just going through sort of swallowing difficulties, what that looks like, what that means. And we'll also be focusing on sort of care planning, the type of support you can give for someone who's got swallowing difficulties. And we'll also just go onto the system at the end, and I can just show you sort of what we've got on the system in relation to that in terms of care planning, alerts that you can put in place, actions that you can put in place, and that kind of thing. So we'll get going with the webinar now. I'm just going to stop my video for this, but I trust that you can still hear me okay. All right, so let's get going. Just so that you're aware, actually, before we start, anyone that's registered will get a CPD certificate. Obviously, you need to have stayed on the session, but we will send out a link. It's probably going to be early next week, and that will give you access to the CPD certificates. So it is CPD accredited. You'll get a CPD certificate. There's also a resource pack that we've got available to you as well. You've all got access to that too. Again, you'll get an email, and that will just basically, it's what I'm discussing today. You'll have it in a resource pack that you can sort of keep and refer to. And also it will have the examples of the care plans that we're looking at and alerts and that type of thing. So don't worry too much about sort of reading every part of the care plan today. You will get that in the resource pack where you'll sort of see examples of a sample person that I've used, and how we might think about supporting that person who may have swallowing difficulties. Okay. So that's what we're looking at today, care planning to support service users with swallowing difficulties. As I say, if you want to unmute yourself and ask a question, feel free to do so, or pop something in the chat. I'm going to look at it periodically so I can answer questions to the best of my ability throughout. If I can't answer the question, I shall try my hardest to get the information for you. So that's just to consider that. Okay, so what we're going to cover today is swallowing difficulties, what that looks like, what that means, causes, etc. Particularly coughing and choking in your service user. We're going to look at chest infections and what that might signify in terms of swallowing difficulties. And then we'll go onto the system and look at suggested care plans to put in place, actions, and all that type of thing. Okay. So first of all, swallowing difficulties. What do we mean when we're talking about swallowing difficulties? So obviously it's difficulty in swallowing for whatever reason that might be, which we're going to investigate shortly. The medical term for swallowing difficulties is dysphagia. So you may or may not have heard of that term, but the term dysphagia means the difficulty or inability to swallow. Okay, there's also dysphagia with an S instead of the G. That's difficulty speaking. So the G, dysphagia, is the swallowing difficulties, the term for swallowing difficulties. I always remember it by gulp. I used to get those mixed up, those terms, but I always remember the G for gulp and dysphagia. Okay. So that may mean certain foods and liquids. Some people with dysphagia have difficulty in swallowing. They might have difficulty in, with certain foods and liquids, have difficulties when it comes to swallowing those. Some people might not be able to swallow at all with dysphagia. Other signs of dysphagia may include coughing and choking. So when they're eating and drinking, they might sort of display coughing or choking. They may bring food back up when they're eating. Sometimes that could be through the nose as well as the mouth. So it's just to be mindful of these things when you're supporting someone with eating and drinking in the service that you're in. The person might get the feeling of something being stuck in their throat. So it's like a sensation that food's stuck in their throat or maybe in their chest. Let's just have a quick look at that. Let's let you know it's our team as a present. Okay. Okay, it could be that we're at full capacity, I guess it might be, but I just say keep trying. with that link. Hopefully you can get in. I'm afraid there's not much I could kind of do about that if they can't get in at this stage. I'd just say maybe sort of keep trying with that link, and hopefully you will get in. It will be available though on our YouTube channel as well, so you can always watch it afterwards. So the feeling of food being stuck in their throat or in their chest, that could be a sign of swallowing difficulties or dysphagia. Someone may drool when they're eating, so saliva, persistent drooling of saliva out the side of their mouth. They may be unable to chew properly if the dysphagia means that they've got kind of lack of muscle tone in their mouth. They might not be able to sort of chew food properly. And some people present with sort of gurgling when they're eating. So that could be like a wet sounding voice when they're eating or drinking. So it's all just things to be mindful of when you're potentially thinking that someone might be having trouble with swallowing. So you need to seek medical advice if you do have that thought that someone might be having swallowing difficulties, because over time dysphagia can also cause symptoms such as weight loss, repeated chest infections. So for example, if they can't swallow properly, they're not going to be eating well probably, and that could cause sort of weight loss and repeated chest infections. Let's have a quick look. Okay. All right. Sorry, there's not much I can do, I'm afraid, if people can't get on it at this stage. Just sort of suggest to keep trying, maybe if they can't get on, just keep trying that link. Okay. So things to look out for. When to seek medical advice. So if someone's got difficulty swallowing or other signs, then you should see your GP immediately if they're having trouble swallowing, or if they've got any other signs that we've just talked about then, so that you can get treatment in place to kind of help with those symptoms. There's things that can be done for people with swallowing difficulties, and a GP should advise on that or make appropriate referrals. It's important to get these things investigated early, because someone that has a swallowing difficulty might have a more serious condition. Esophageal cancer, for example, can affect swallowing. So it's important, if you are worried about someone or concerned, get help as soon as, so that they can get investigated early and sort of catch anything that may be causing that or treat appropriately. So the GP needs to assess, and they can refer for further tests or what have you. So what can we do to treat dysphagia? That's what we're going to look at next. So when we look at cause and type, treatment depends on what's causing the dysphagia, of course. So whatever it is that might be causing it will depend on what treatment that person has. Careful management is required, and lots of cases of dysphagia, as I said, can be improved with careful management, and you need to get specialist advice on that. A cure isn't always possible, but it can certainly be improved. When I talk about treatments for dysphagia, that might mean speech and language therapy. That's very often the people that will be, the person will be referred to. So the SALT team, you might have heard of the SALT team. So that's speech and language therapists. And they are specialists that help people recover their swallowing. And that might be through certain exercises or techniques to improve their swallowing. They may also recommend changing the consistency of someone's food to make it safer to swallow. So food and fluids, changing the consistency. So we hear of like pureeing food, soft diet, or maybe thickening fluids. So that's something that a speech and language therapist can advise in terms of what the service users should have consistency-wise when it comes to food and drink. There might be the need for other forms of feeding, so tube feeding through the nose or the stomach. If that person cannot swallow at that particular time, that swallowing may improve, it may not, but it might be appropriate at the time because they need their nutrients, they need their food and fluids. It might be appropriate to feed them temporarily with a tube. And again, that will be advised by specialists. There's also surgery that can be had to widen the esophagus. So depending on what the cause of it is, but that sort of pretty much involves stretching the esophagus or inserting a stent, so like a plastic or a metal tube into the esophagus to help that person swallow. Looking at causes of dysphagia, because there can be many different reasons as to why someone cannot swallow, and it's generally caused by another health condition. So conditions affecting the nervous system. So that might be things like stroke. So someone's had a CVA, so stroke, a head injury could have affected swallowing, depending on what part of the brain is affected. Multiple sclerosis or someone with dementia, for example, they could affect the nervous system and therefore affect the swallowing functioning. Sometimes people with cancer might have their swallowing affected. So like we said, esophageal cancer or certain mouth cancers. And then there is quite a common disease called GORD, which is gastroesophageal reflux disease. And that is where stomach acid kind of leaks back up into the esophagus. So that can damage your sort of swallowing functioning. Children can also have dysphagia as well as a result of a developmental or perhaps learning disability. So if they may have cerebral palsy as well, that can affect swallowing in children and then onto adults. So the complications of dysphagia, well, of course, the immediate thing is coughing and choking. So food going down the wrong way. That can lead to further problems if you are coughing and choking. So that's one of the most common problems. It's sort of displaying coughing and choking. So it feels like the food's gone down the wrong way. It could block your airway. If food is going down the wrong way, i.e. into your lungs rather than your stomach, that can lead to, well, I mean, it could obstruct the airway, but if it's just sort of small amounts going down the wrong way, that can lead to chest infections. There's something called aspiration pneumonia. And so aspiration is when food goes dointo the wrong way into sort of airway. That can cause pneumonia. Will require urgent medical treatment to sort of get that treated and resolved. So aspiration pneumonia can develop after accidentally inhaling something. So it might be a small piece of food, for example. And aspiration pneumonia warning signs are a wet, gurgly voice. So that would be, as we said before, whilst eating or drinking, it might present with a sort of wet, gurgly voice. That could suggest that it's going down the wrong way. Coughing, as we said before, whilst eating or drinking, and then maybe difficulty breathing. So breathing could sort of present as being quite rapid and shallow if something has sort of gotten into their lungs. So if these symptoms do develop, then of course GP immediately, if it was obviously a blockage or partial blockage, and you want to sort of call emergency services. But if it's something that seems to be happening over time, coughing, wet, gurgly voice, when they're eating, then contact the GP for an immediate review. So as we said with dysphagia, people can avoid eating and drinking because they might fear choking. So if it has been going down the wrong way, or if they feel they can't swallow properly, there's obviously going to be a fear of choking. That can lead to not eating or eating reduced amounts through fear of choking. That can obviously lead to malnutrition or dehydration. Naturally, that would then affect your quality of life because it may prevent you from enjoying things that you like, meals, social occasions, that type of thing. So it can have a real knock-on effect with quality of life. So we're looking today really at care planning and support for people with a swallowing difficulty. And these are the things that we'll look at on the system as well. So it might be worth doing a choking assessment if you do have people with sort of conditions that affect the nervous system or dementia and that type of thing. If someone has had a stroke, it's just things to be aware of, that this might develop into swallowing difficulties. And you could do a choking assessment. We have one on the system. I'll show you it shortly. But that looks at whether you've noticed someone's coughing or choking when they're eating. Does it sound like food's going down the wrong way? Do they have difficulties chewing, for example? Are they kind of rushing their food or cramming food in? Are they talking while they're eating? Are they easily distracted? So it's kind of looking at these things and deciding whether you feel they may be at risk of choking, and then, contacting the doctor appropriately, who can do the appropriate treatment or referrals. Also, mouth care assessments. We have those on the system, and mouth care obviously is incredibly important. And the health of the mouth is incredibly important to ensure that eating is comfortable in the first place for that person. When it comes to eating and drinking care plans rather, the support is really important. It's really important you put robust support in there for that person. So that could be any of the following. It's not an exhaustive list. Oh, this is being recorded actually. So it is actually being recorded and it's available on our it will be available on our YouTube channel, and you will be getting a recording of this. You'll all be getting a recording. Okay. So, I mean, I'll allow you because that's fine for you to record it. But yes, it will be available to you, whoever's registered for this. So when we're looking at care plan support, that could mean any of the following. So close support at meal times. So just supporting that person really on a one-to-one basis. That might look like encouraging the person to slow down when they're eating, help them to concentrate, sitting with them, make sure they're focused on their meal. It might mean making sure they're sat upright. Some people can slouch when they're eating, especially people with sort of mobility issues and posture issues and gait issues. So it's just important to make sure they're sitting upright in a comfortable and well-supported position. So that might be, you know, a certain dining room chair, cushions, etc., just to make sure that they're sitting upright, and maybe encouraging smaller sips and mouthfuls of food. Of course, the main thing is that you need to follow the SALT advice, follow the speech and language therapy advice. So make sure that they are given the correct food consistency that's been advised, make sure it's the correct texture to minimize the risk of choking. So really important that you get that speech and language therapy advice into your care plans, so that people can all be aware of what advice they've given and follow that accordingly. Ensuring their mouth is clear. Sometimes people who have like reduced sensation maybe in their mouths or difficulty swallowing may find that food residue gets left inside the cheeks after eating. It's called pocketing or pouching food. That does sometimes happen. It might be because they can't chew effectively. So food kind of stays in larger pieces in their mouth, then it can get trapped in their cheeks. It might be that for whatever reason or whatever condition they have, they've got reduced tongue movements. So they find it difficult to clear the residue themselves with their tongue. They might have reduced sensation. So they might not even know the food's there, for example. And of course, that can be a choking risk because if it's sitting in their mouth and they're not aware of it, they could choke on that. So it is important, therefore, to offer mouth care. Okay, and this is the sort of thing you can put in your care plan as part of the support you're going to give them, is good, thorough mouth care after eating, just to make sure that any residue is cleared away and there's no choking risk there. You might consider softer foods for somebody. So if they haven't sort of seen a speech and language therapist yet, consider softer foods. It's best to wait for them to see what sort of consistency they recommend. But it could be, you know, better to maybe have sort of a mashed potato rather than a roast potato, for example, if you do feel that someone is having trouble swallowing their food. Chest infection monitoring. So this is an important thing to put in your support part of your care plan. And it's basically asking yourself or monitoring as to whether the person is having recurrent chest infections, because this may be related to something else, but it may be related to aspiration. So if food, drink, or saliva, for example, is going down the wrong way, so it's ending up in the lungs rather than the stomach. Because aspiration can cause recurrent chest infections, and that can lead to obviously pneumonia, which can be very serious, sometimes fatal. And usually aspiration, as we said, it will cause coughing and choking, but it doesn't always cause coughing and choking. It might happen without any obvious signs, so without any signs of coughing and choking. That's called silent aspiration. So in other words, there's no obvious signs, but there is food or small particles or saliva going in to the airway, going down into the lungs. And if there's no obvious symptoms, that's what we call silent aspiration. So for someone with recurrent chest infections, even if they're not necessarily showing signs of coughing and choking at meal times or what have you, it doesn't necessarily mean that they're not aspirating. If they're getting recurrent chest infections, be mindful of that could be this silent aspiration. So it could be that they're having swallowing difficulties, so it would be worth mentioning that to the GP for assessment. And also good oral hygiene is really important, as we've talked about. So not only mouth care for clearing pockets of food, but also reducing the bacteria in the mouth, because that can sort of be caught in the saliva, that can go into the lungs if they're aspirating. And of course, bacteria in the lungs can cause infections as well. So just all things to be mindful of, and all things that you can kind of include in your support plan. So whatever stage they're at, it might be that they've not been seen by speech and language therapy yet, but you can still put support in place if you feel they are coughing and choking. Then you can seek the advice from the SALT team and then update your care plans appropriately. People's needs change, so care plans obviously need to change to reflect that. So when we look at charts and things that you can put in place, monitoring actions that you can put in place, they may include food charts. So on the food charts that we have on our system, you can put support instructions in place. So not only can you put the food chart in place, so saying what they've eaten and what have you, or what they've been offered, but you can also put instructions in. So if they are on a pureed diet or a soft diet or thickened fluids, if there's any salt requirements, you can put those into the care instructions so everybody is aware of what that person should be eating. Fluid charts as well, so you can record and monitor what people are drinking. And again, on the support instructions there, you can put if someone's having their fluids thickened, what product is being used for that, how many spoonfuls should be put in how many millimeters of fluid or what have you. You can put all those support instructions on the fluid chart so that everyone can see exactly what consistency it should be. Weight charts. So as we said before, people that are having problems swallowing may not be eating well, may be reluctant to eat if they're coughing and choking, or sort of gurgling when they're eating. So they are at risk of, malnourishment and losing weight. So it's important to monitor that weight. You can put alerts on the system. So you might want to do a monthly weight on somebody, a weekly weight, not to do a daily weight, whatever you feel appropriate for that person, or whatever you've been advised to do, or whatever the must tool has told you to do, then you can put alerts onto the weight charts. You can put alerts onto all of our actions if you feel that they're necessary. We've got mouthcare charts in place as well, which you can just keep in place to report on when you've done mouthcare on somebody, when you've supported someone with mouthcare, when you've helped them after their food to make sure there's no pocketing. We have dietary alerts on the system and choking alerts. So it's a little symbol that you can put in place, and that just alerts everyone to, dietary requirements or choking risks. And again, you can put information behind that alert. So you just tap onto it to see what the dietary alert is, for example, and it might be this person's on thickened fluids or pureed diet or whatever it might be. So what we'll do now is we will go on to the system. Before I go on to that, I just wanted to mention, because it's just something to be aware of, the speech and language therapists often use the IDSI. You may have heard of the IDSI. That's IDDSI. It's the International Dysphagia Diet Standardization Initiative. Okay, so if you go onto the website, you can look for that and what that sort of means. And it's basically 8 levels of consistencies for drinks and foods. So it's kind of looking at recommendations, for example, thickened fluids or a soft diet or pureed diet. There's different kind of thicknesses and consistencies. It correlates to a certain number. And it's kind of like, it's basically common terminology to describe food textures and drink thicknesses. That's often used by speech and language therapists. It's just important to be aware of those. Good practice to be aware of those. You can actually, if you want, I'll give you the website. I haven't got it on the webinar, I'm afraid, but I can tell you it. It's iddsi.org/framework. That will take you to the website that will give you lots of information on that, lots of useful information. So that's iddsi.org/framework. Okay, so we'll go and have a look at some examples of what I've put in place for care plans and actions and things. Let's just have a quick look and see if we've got any messages. None so far. Okay. So we're now on to Care Beans Lodge. So this is my demo site. So these aren't real people. This is just a sample person that I've put onto the system. It's a sample care plan that I've done. Obviously, all care plans will be different depending on what the person's needs are. It's not for me to say exactly what support you should be giving or not giving. That's up to your assessment of that service user and medical support that's suggested or speech and language therapy support that's suggested. But I can just give you an example of where it sits in the system and what kind of things we've got available. Okay, so let's have a look at Sally Webb. And like I say, you're going to get a resource pack for this, so that will have these care plans on it. So you'll see the sort of examples of care plans that I've put in place, just so you can see the content. Just gives you an idea of the sort of content of the care plan that I've done. So if I go into her main care plan page here, there's a couple of things that we can look at. So I'll go into her eating and drinking care plan in a sec, but what I have put on here is a couple of alerts, and these all also go through to the app, so it goes through to the devices. So all the staff members, carers, senior carers, nurses, anyone that can access the app, when they log in, they will get this initial page of alerts, just so that they're all aware of the overview of that person. So for example here, if you click on it, you can see she's at aspiration risk and she's got swallowing difficulties and what support she needs. I've also put in here that she might be at choking risk, so you can decide if you want to put these alerts in place. And just to show you for the customers that are on the webinar at the moment, just to show you where to do that in case you were unsure, on this main care plan page, if you go into the conditions and alerts section there, and if you scroll down, this is where you get all these little alerts here. So if you say yes to it, it will then pop that alert with that person's details and kind of follow them around the system. So we've said, yes, she's got dietary requirements. There's a drop-down list. You can pick multiple ones and you can put some more detail in here. Okay. Got the same for choking risk a bit further down. And this is where we've got those different terminologies that the IDs are used there. So you can pop those in place, and also with the fluids as well. Okay. So put details in there. So I've just put that information in there, saved it, and then it will sit with them on the system. That's an idea of the alerts that you can put in place. But then when it comes to the care plan, I've done an eating and drinking care plan for Sally. So my Sally's been seen by the speech and language therapist recently. So I've put that in my review. She's been seen by the SALT assessment team. They've advised these particular exercises and for her food to be soft and bite-sized and fluids slightly thickened. So I've gone into my care plan and I've just put here what the issues are. So she's been seen by the SALT team because she was having difficulty swallowing food. She's got dysphagia. She's at risk of undernourishment and dehydration. So these are kind of the issues. And again, you'll get all these examples. I've put the goals. So to maintain a healthy weight, good levels of nutrition and hydration, maintain a healthy weight, be treated with dignity at all times. And then I've put in place some support, robust support plan. So here we've got the must guidance actually, because up here I did do a must tool. So you've got your must tool in place there as well. That's sort of giving me a risk level for her. I've put all that must guidance in here, what they recommend. I've also put some support that we're going to give her as a service. So that's, things like we'll encourage people to sit her in an upright position so that she's comfortable. This is what sort of food she likes. Make sure she feels relaxed and doesn't feel the need to hurry her food. So it's all different sort of considerations that we've taken into account. And then I've put in the SALT team guidelines as well. So they've suggested that her food be fork mashable, so soft diet. I've described what that means. This is what the speech and language therapists have recommended. They've also recommended what types of food that could be like. So I've put that in there as well. So it's all very clear what kind of food and what kind of consistencies she should be having, and also that her food should be thickened. I put this in place as well because this is just more of an example. She wouldn't be all of these. She's only going to be one or the other. But I've just put this as an example so that you can see that IDSI. So it's this International Dysphagia Diet Standardization Initiative. So IDSI. So this is what it looks like. There's all these different levels. So as I said, it's common terminology to describe food thicknesses and textures and what have you. So for the foods, it correlates with these numbers. The drinks, it correlates with these numbers. Okay. So just to make sure that you get all your support in there for that person. That might change as time goes on. When you do your monthly reviews, etc., you can update it accordingly. All your old care plans will always be kept, but you can update them as and when you need to. Okay. You can also put in risk assessments. Actually, I think I've put one in here for a choking risk assessment. So we suspect she's at risk of choking. So I've just been able to pull up a sort of blank risk assessment. I've looked at what the risk is, why she's at risk of choking, and what we're going to put in place here to sort of reduce that risk of choking. So I put all the speech and language therapy advice in there. That's what we're going to do, and that's sort of basically what we've put in the support section of the care plan. I've also put it in here as well because I want to do a separate risk assessment, because I want to use this matrix, which looks at what the risk assessment would be if we didn't assist her in any way and what the target is. And every month I'm going to make sure we're reaching that target where she's not having any incidences of coughing and choking. So I can review that monthly or as and when I need to. Okay. So that's your care plan. You'll be getting an example of that in your resource pack. And then if we move, actually, let me show you, I'll show you on someone else. Let me go and have a look. I'll just show you this choking assessment that we have as well, which you might wish to put in place for somebody. So if you're thinking they may be at risk of choking, you can always do a choking risk assessment and link it into your eating and drinking care plan. Let's look at James. I think put one in for him earlier. So yeah, he's got a choking risk assessment here. I'd link that into an eating and drinking care plan if I wanted to do one, if I felt it was appropriate. And this is what it looks like, really. It's just a series of questions. Do they cough before, during, or after eating and drinking? Do they already have a diagnosis of dysphagia? Have they had any partial or complete obstructions in the last 12 months? So you simply answer yes. If it's a yes answer, and put any comments and action to be taken. It forms part of your care plan building process. There's lots of sort of questions pertaining to choking or the potential of choking. And then medication-wise, they might be getting side effects that could risk choking. So if they are on any medications, you can see what sort of side effects there may be there, which could become a choking risk. You could just put anything else in that evidence box as well. Any comments and actions to be taken too. So that's the choking risk assessment. And then if we just have a look at, we'll go back to Sally, because I'll just show you what I've put in place for her actions-wise. So I can do actions as part of my eating and drinking care plan, but I can also come up here into my main actions button. It's got lots of different things in place, but the things that we've put in place referring to, or linked in with the eating and drinking care plan are the food chart, a fluid chart. I've put a mouth care chart in place as well and a weight chart. Okay, so let's have a look at what that looks like for the carer or the nurse filling that in. I'll go onto the carer dashboard. Okay, you can access this via the app as well. So for example, if we go into the food chart, here we go. I've put lots of instructions here. So she's at choking risk. Please follow the SALT instructions. This is what she needs. Fork mashable diet, thickened liquids. Okay. So everyone knows what sort of support she requires. So not only is it in the care plan, which carers and nurses can access to view, they can also have a sort of summary here of what that person's needs are. And then obviously put what they've had, roughly what they've eaten, detail it down here, and then save that. Okay. And they can sort of have a look at what they've been eating prior. But it's just it's these care instructions that I just want you to be aware of that you can put in to sort of give particular support that's required. I've done the same in the fluid chart. So I've put in that her fluids are to be thickened. This is what we'd like her to drink about 2 litres a day. This is what she likes drinks wise. And she's on thickened fluids. We could put instructions of how to thicken those fluids as well if we wanted to in there. Okay. Mouth care chart. Let's have a quick look at that. The mouth care chart. Just put some details about what sort of mouth care she is. You could put in here about she often pockets food in her cheeks. You could put all that sort of information in there. You could put tick boxes in if you wanted to. There's tick boxes in the checklist section of the system that you can pull through. So you can do all sorts of things really in terms of actions and things that you want to report on. And then we've got a monthly wait chart. This one's overdue. That's why it's flashing. So that's what I meant before about putting alerts in place. So I know that needs to be done. So I can do her wait, save that. And just another way I can do that style of reporting. And that's pretty much the webinar for today, really. So if there's any questions from anyone, please do ask. If I don't know the answer, I shall find out for you. But do ask if you've got anything or you want me to go over anything in the system. As I say, you will get your CPD certificate if you've attended the full session. And you will also get access to the resource packs where I've put details of the actions you can put in place with the care instructions, the eating and drinking care plan with what to put where, alerts you want to put in place so that you're sort of fully covered for that person and you're doing the best you can to support them if they do have swallowing difficulties. Okay. So I'll just stay on for a little bit longer. We have a sort of Q&A at the end, so do feel free to ask anything. This is just sort of opportunity to ask, go over what we've talked about. I can't sort of give advice on individual service users, of course, but I can sort of maybe help. Doesn't look like there's anyone on the chat, so that's fine if you haven't. And I hope that's been okay and sort of easy to follow. We do have these webinars once a month. So we've got mouth care actually next month, last Tuesday and last Thursday of every month. We've got with dementia, if someone has food sore in their cheeks, how would be best to deal with that? So Annie's asking, with someone with dementia, if someone has got food stored in their cheeks, how would be the best way to deal with that? I mean, yeah, as they're not always compliant, yes, it is difficult. I mean, there's no kind of, you sort of can't force someone's mouth open, but you need to do the best you can to, that is a choking risk if it's in someone's cheeks. If it's stored in their cheeks and they're not swallowing it or they're having difficulty swallowing it, that is really quite a high risk of choking. So it is, sort of imperative that you do try your best to get that out of the person's cheeks. So I guess it's all about approaching that person in a sensitive way, explaining what it is you're going to do, and trying to sort of tackle it that way, I guess. But yes, it's difficult to say. I mean, I couldn't say force their mouth open. That wouldn't be right to say that. You can't do that. But it is, you do need to sort of get that out of their mouth as quickly as possible if they are storing it in their cheeks. But yeah, I know people aren't always compliant. It's a difficult one. I guess it's just about approaching them sensitively and gently and sort of trying to eke it out. Questions? Okay, so it doesn't look like there's any more questions. So that's fine. If that suggests that you've understood it all and you're happy with it, which I hope is the case. We'll be doing more of these last Tuesday, last Thursday, every month. So do feel free to tell your colleagues about them. If anyone who isn't a customer does want a demo of the Care Beans, please do feel free to contact me or the team. My email's lucy@carebeans.co.uk. That's Lucy, lucy@carebeans.co.uk. Do feel free to message me and ask for a demo. Quite happy to do one with any of you. That's fine. Oh, you're welcome, Shijima. That's fine. No problem at all. Okay, so I think that's probably wraps up today's session. Keep your eye out for your emails with access to your CPD certificate. Like I say, that's possibly going to be early next week. rather than this week. So just keep your eye out for that, details of the resource pack and that type of thing. This was recorded, so the recording will be available to you. And yeah, thanks for joining today.